Hi folks, this is Hariam for CWinner. Today we are going to talk about exercise and pain. I think there is two myths among physiotherapists and people who prescribe physiotherapy, that is probably orthopedicians and other garden variety physicians. Now, one of the common things we hear is give 5 days of IFT or ultrasound or whatnot, or even painkillers, and then do the exercise. This is common when we ask physiotherapists, as well as when patients come and tell us that this is what my doctor told me and why are asking me to do exercise in the first day. Now, this is based on two myths. The first myth is that we are healing via ultrasound or via NSAIDs or other painkillers or IFT and things like that, right? This is a simple thing you should have read in Pathology 101, that healing is a natural process. You cannot accelerate or decelerate. Some environmental factors can decelerate, like infection and things like that. But other than that, you can't accelerate healing. So if you give ultrasound or IFT or painkillers, you are not healing anything, right? So to wait for 5 days, it just seems to me as though it feels like I will wait for it to heal by itself rather than do anything, right? As Voltaire said, we are just entertaining the patient for the first 5 days. The next problem is we also assume that pain is the only thing they come for. We don't think they have, or it's not in our mind that they don't have any problems in walking, bending, or riding a bicycle or a car. So for that, what are we doing? It seems waiting for the first 5 days or 10 days, it doesn't make any sense, right? So in the starting period when you have pain, you need to give exercise. Exercise is a physical means by which the biology gets better, right? The biology gets better with physical means, that is your exercise, right? So this is just a nonsensical myth which has creeped into medicine, that you have to wait or you should not do exercise when you have pain. I think as physiotherapists, we have a major role in educating people as well as other medical professionals to say that no, we have to do exercise when you have pain. This is vital part of physiotherapy as well as vital part of recovery, either disability like getting back to walking, getting back to functional activity, or getting better with pain. Pain also gets reduced with exercise, right? So in this short video, I want to emphasize that you can give exercise when you have pain. Pain is a treatment for, exercise is a treatment for pain. So don't be shy about giving that. We need to stop this myth of waiting for 5 days or 10 days until the pain reduces and then start treatment. It doesn't make any sense, and we should fight these things. Thank you so much. We will see you in another video. If you like videos like this, subscribe to our channel. Thank you.